Yes, this is Bush Radio 89.5 FM, and the show is Sekisizwe, Building the Nation Bodinasi, focusing on health issues. And on the line, I am joined by Dr. Stephen Jeffery, a gynecologist, to tell us more about urinary incontinence. It is reported that although it's a common condition, fewer than 40% of incontinent individuals seek medical advice. The doctor will explain more about the symptoms and whether you can treat it or not. Doctor, welcome and thank you for joining us.
Yeah, thank you very much for having me.
When we talk about urinary incontinence, what exactly are we talking about?
So we're talking here about women and men who have involuntary leakage of urine, and this might be associated with either leakage with coughing, laughing, sneezing, or activities. And then you get another set of women and men, but mostly women, who leak with not being able to get to the toilet on time. And that is a symptom of urgency. And so people might relate to the fact that they get the feeling that they need to go to the toilet, but they don't manage to get there in time, and then they have an accident on the way to the toilet. And a lot of women actually do make it, but they find themselves going to the toilet a lot as well. So those are the sort of main issues when it comes to urinary incontinence.
In terms of the causes, what causes urinary incontinence?
So, and my main specialty is looking after women with urinary incontinence. So I think we will do well to focus mainly on these problems in women. And so it's more common in women as they get older, and a lot of it is related to childbirth. And there is some good work to suggest that having a baby through a vaginal delivery is a common thing that might start off the process. However, there are other things that will make it worse, or bring the problem so that it actually becomes more manifest later in life. So, but childbirth is a big issue, and then there are some other things like having surgery and having radiotherapy, etc.
All right. Now, a lot of people, they believe that bladder control loss is a natural part of getting older. If someone notices this, should they be worried? Should they take action immediately?
Look, I mean, this is an issue that is related to one's quality of life. And so most of the time it's not anything that's dangerous or going to cause them to become very sick. But from my experience is that a lot of people find that this really does affect them in a big way in terms of their social life, their work life, and just their ability to get on with their day-to-day activities. And so if people find that they're managing with the problem and it's not actually having such a major impact on their lifestyle, then it's not something that they necessarily need to go and see someone about. But I find that a lot of women are either too embarrassed to go and seek help, and often they will try and manage on their own for quite a long time before they actually go to a doctor or to a clinic to actually try and get this problem solved. So the times when it should actually be looked at more urgently is if someone has got some other symptoms, like maybe pain, anyone who sees blood in their pee, those sorts of things should be sought quite quickly. And anyone who's got a lot of burning when they pee, then that should probably, in association with urinary incontinence, be looked at a little bit more urgently. But most of the time, it does actually depend more on how it's impacting on your quality of your life.
And the kind of treatment that is available, is it something that's treatable, or you just have to know how to control it?
So it depends on a lot of factors, and I've already said there are two main types of incontinence. One of the ones which is treatable by doing surgery is the one with what we call stress incontinence. And when we talk about stress incontinence, we're talking about leakage associated with stress, which means increasing your intra-abdominal pressure, like coughing and laughing. We're not talking about stress by children who giving it problems, or husband who's making life difficult. We're talking about stress related to increasing your pressure in your abdomen. So that specific type of incontinence is treated firstly by advising women about some exercises. So we can go some way in treating these women with pelvic floor exercises, and there's some very good physiotherapists in Cape Town and other parts of the country who are able women to teach them to do these pelvic floor exercises. many of the listeners might have heard of the Kegel exercises. And those are those pelvic floor exercises, and that is the first step in managing the problem of stress incontinence. But after that, we can then move on to doing a small surgical intervention, which takes about a half an hour with a very short anesthetic, an overnight stay in hospital, and there you can put in a little plastic kind of sling under the bladder, and that is normally effective in about 9 out of 10 cases, and it's actually a very good operation.
Is it not expensive?
Well, there is, for women on medical aid, it's normally well covered by the medical aids. And we are offering that operation here at Grooteskies. So if someone does identify with this problem and don't have a medical aid, then you could certainly go to your clinic and get a referral to Grooteskies, and you'll be able to go onto the waiting list for that. So it certainly is covered by most medical aids, and I know in other parts of the country they're also doing this in most of the state hospitals. So treatment is readily available, and most private gynecologists and urologists are able to either do this operation or to have access to the operation through someone else. So it certainly is something that is quite readily available.
Now, I believe that the issue around people who are diabetic, it said that diabetes is one of the single most modifiable risk factor for managing bladder weakness. For someone who's diabetic, when it comes to the issue of incontinence, how do they control it? Is it also doing the same thing where you have to go for either pelvic exercises or doing surgery, or it is about adjusting your lifestyle as it is necessary to manage your diabetes?
Thanks. That's a very good question. When a diabetic presents with urinary incontinence, I think it's essential that they get seen by a doctor who has a good understanding about the whole issue around bladder problems and diabetes. Now, diabetes can affect the bladder in different ways. One of them is that they get, women and men who've got diabetes, they'll get a neuropathy, which is a neurological problem, where the bladder might not actually fully appreciate the sensation of being full. And so those patients might then get what we call an overflow incontinence. So that is often very easily treated by just advising patients to make sure that the bladder is emptied on a regular basis. But I think anyone who does have bladder problems and they're diabetic should be assessed properly by a doctor, because there might be some other issues that are at play. So I think that is something that needs attention. We also haven't mentioned the other problem of incontinence, and that is this urgency incontinence, and that is not managed by a operation, that is more managed by medication. We can talk about that a little bit later if you want to.
Okay, explain it to the listeners.
So I've already told you that many of the listeners will identify with the problem of urgency incontinence, which is that problem where you found that you really can't control your bladder, where you have to rush to the toilet, you don't get there in time, and you sort of leak, or you just make it. And that is not treated by an operation, and that's why assessing someone with incontinence is actually quite an important aspect in the workup. That is treated firstly by addressing your fluid intake, reducing the amount of tea and coffee that you drink, and things like your fizzy drinks. And then there is some medication on the market that we can treat these patients with. So that would also need to be assessed properly by a physician. Okay,
so you can't just get it over the counter?
Unfortunately not, because it needs proper assessment. And those patients would obviously then need to, possibly have a number of other investigations as well, like looking for a urinary tract infection. And possibly what we call a cystoscopy, where we look inside the bladder with a small camera just to check if there's nothing serious happening.
And how often would you say it is recommended for someone to take medication instead of going for surgery?
So, unfortunately, a lot of patients with incontinence have a picture which is a little bit mixed. So some patients will have a leakage associated both with coughing and laughing, and being able to and needing also leakage associated with rushing to the toilet. So, but I'd say about 45 to 50% of patients with, and we're talking about women specifically, with incontinence will have a stress incontinence type picture, which might actually be amenable to surgery. The rest of the patients would need to, be managed with medication, and an operation wouldn't actually help their symptoms. So it's important that surgery isn't done for the wrong indication, and that a competent person actually assesses these patients.
Now, I just got an SMS here, Doctor, from a man. He says he's a 65-year-old man who suffers from incontinence as well, and it can be very embarrassing. What can he do to treat it? I believe you've been focusing mostly on women. For men who also have incontinence, do they go to the same procedure when it comes to treatment?
Yes, so men with incontinence, it might be more related to enlargement of the prostate. It could be related to an urinary tract infection. But yes, studies have shown that up to a third of men will have these problems, especially as they get closer to the 60s and the 70s. So it sounds like for this gentleman, it's become something that is affecting his quality of life quite substantially. Now I would start by going to either his GP, or if he can, go to the day hospital, to the clinic, and they can then refer him on to a specialist who would be able to then assess exactly what's going on. And yes, there is definitely treatment available for that. And I think the important thing is for people to know that there is some sort of treatment available to at least give some relief for the symptoms, if not cure them. So certainly for someone like that, I think they should go and get assessed and not be embarrassed, which I think is the most important message that people should take home, is that there is treatment available, and there are those of us who actually dedicate most of our working lives to managing these problems.
Yes. So just go out there, help is available.
Yes.
Last words to the listeners. People want more information. Where can they get more information about managing this condition?
So there are a number of places. I think if you want to go online, there are a number of websites that are able to give you some direction as to where to go. There's a website which is sponsored by TENA, and they can go to TENA.co.za. That is TENA.co.za. And then if someone is really feeling like they want some treatment, I think it would be useful to go and see one of their doctors, or one of the clinic sisters, and they'll be able to refer them in the right direction.
Okay, so they can go to www.tena.co.za, or they can call, go to your nearest hospital for more information.
Yes.
Fantastic. Well, Dr. Jeffery, thank you so much for joining us and sharing that information with the listeners. Your time is highly appreciated.
It's a pleasure, and have a nice day.
Thank you. You too.
Okay, bye-bye.
That was Dr. Stephen Jeffery. He is a gynecologist at Grooteskiel Hospital, joining us to talk about urinary incontinence. It is reported that although it's a common condition, fewer than 40% of incontinent individuals seek medical advice. Rather than seek treatment, the vast majority adapt to their problem by altering their lifestyle. But they say that reasons for failing to report symptoms include the perception that incontinence is normal with advancing age, or that symptoms are not severe enough to treat. But can Doctor explain more about the available treatment? If you have, if you want more information, you can go to www.tena.co.za, www.tena.co.za, or go to your nearest hospital or day hospital. Information is readily available for people who want help. This is Bush Radio 89.5 FM. Stay tuned.